Welcome to the research samples training video for the REMAP-CAP updated immunoglobulin domain. Research samples should be collected from all patients randomized to this domain, regardless of their treatment allocation. A blood sample needs to be collected at baseline only. A respiratory swab sample, and this can be an oropharyngeal or nasopharyngeal sample, should also be collected at baseline, and then every subsequent week that the patient is in hospital, or until they test negative for COVID-19 in 2 consecutive tests. The day 1 blood and swab samples must be collected prior to administration of convalescent plasma if the patient has been randomized to this arm. Sample kits will be provided by the Clinical Trials Unit at NHS Blood and Transplant. These sample kits cover the packaging and transport of the samples, but the sample collection tubes and personal protective equipment are locally provided. It's important to note that yellow top tubes are preferable for collecting a blood sample, as these tubes allow for easier serum separation. The sample kits you receive from the Clinical Trials Unit will contain the following items: a plastic tube with absorbent white material inside. This will act as the secondary container for the sample when it is shipped. An outer cardboard box replacing the sample tube and secondary container in. A plastic tamper-proof outer mailing bag compliant with UN 3373 for shipping the sample. A prepaid Royal Mail address label is also provided for attaching to the outside of the bag. There's a sample tube sticker for completing and attaching to the sample tube, and a mailing bag sticker for completing and attaching to the outside of the mailing bag. Finally, a sample tracking form is provided which needs to be completed and sent alongside the sample. A separate sample kit should be used for posting each sample. This means the blood and respiratory samples collected at day 1 must be packaged and posted separately using separate sample kits. As mentioned on the previous slide, there are 2 different sample labels included in the sample kits. The first is a sample tube sticker, which needs to be affixed to the side of the sample tube. This sticker needs to be completed with the patient's REMAP-CAP randomization number, the sample type and time point, and the date of sample collection. The mailing bag sticker needs to be affixed to the outer mailing bag. This sticker is completed to indicate whether the bag contains a blood or respiratory swab sample, so the receiving lab can distinguish between the samples as soon as they arrive. A sample tracking sheet needs to be completed for each sample that is collected. The completed form should be included in the bag with the sample. The form needs to be completed with the following information: the REMAP-CAP randomization number, the sample type, so whether it's a blood or respiratory sample, yes, no, which sample was collected, the day or time point of the sample, the date the sample was posted, any comments about the sample, and then each form needs to be signed and dated by the person completing the form. And the sample tracking sheet can also be found in Appendix C of the laboratory SOP. Following sample collection, complete and place the sample tube label on the side of the sample tube. Place the labelled sample tube and the absorbent white material in the secondary container. Then place the secondary container in the outer cardboard box. Place the outer cardboard box in the tamper-proof mailing bag, but do not seal the bag at this stage. Complete the sample tracking sheet and add it to the tamper-proof mailing bag. The bag can now be sealed. Place the sticker on the outer mailing bag and tick to indicate whether the sample is a blood sample or a respiratory swab sample. Post the sample on the same day as collection, but if this is not possible, store the samples in a designated fridge and post the next working day. Please notify the Clinical Trials Unit at NHSBT once the samples have been collected and sent. Remember to send 1 sample per kit, meaning this process will need to be repeated twice at day 1, once for the blood sample and once for the respiratory sample. So to summarise research sample collection for the REMAP-CAP immunoglobulin domain, a blood sample is collected at day 1 only in a locally provided yellow top blood tube, and a respiratory swab sample is collected at day 1, and every subsequent week the patient is in hospital or until they have 2 consecutive negative tests, and those samples are also collected in locally provided swab tubes. Please refer to the laboratory SOP for the domain for further details on sample collection, packing and shipment. And if you have any questions at all, please get in touch with the team at REMAP-CAP@nhsbt.nhs.uk. Thank you for listening to this presentation.